Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome to Antiviral Agents Part 2. In this video, I will cover the topic of anti-herpes agents. These are the list of herpes viridae family. There are human herpes virus 1 until 8, and some of them are quite common in our community. These are the list of antiviral drugs that can be used to treat herpes viral infections. From the list, most of them are purine or pyrimidine analog, except for foscarnet and formamycin. Purine and pyrimidine analogs here means it can be in the form of guanosine, adenosine, thymidine, or cytosine analog that will compete with the host nucleotides in the process of viral RNA or DNA replication. These diagrams will explain more about the purine and pyrimidine analogs. During the RNA or DNA replication process, the process will be catalyzed by enzyme reverse transcriptase for RNA or DNA polymerase for DNA. What these drugs going to do is, during the RNA or DNA replication process, these analogs will compete with the host nucleotide. These nucleotide analogs will bind to their nucleotide partners and will prevent further elongation of the complementary DNA. This condition is called chain termination. The first drug that I would like to share with you is aciclovir. Aciclovir is a guanosine analog. Aciclovir is among the drugs that need to be phosphorylated by various enzymes called thymidine kinase before they can exert their actions. This enzyme converts aciclovir to aciclovir monophosphate, which is further converted into aciclovir triphosphate by the host cell enzymes. Aciclovir inhibits viral DNA polymerase by competing with deoxyguanosine triphosphate, the host nucleotide, during the replication process, resulting in chain termination. Aciclovir is effective in infectious conditions such as in herpes simplex 1 and 2, varicella zoster, Epstein-Barr virus, and for the prophylaxis of cytomegalovirus infection. Aciclovir also drug of choice for oral herpes infection, herpes simplex encephalitis, genital herpes, and neonatal herpes infection. Aciclovir can be given by oral, intravenous, or topical route. Through the oral route, its bioavailability is around 15 to 20%. It is well distributed and excreted by the kidneys, and its half-life is about 3 hours in patients with normal kidney function. Aciclovir adverse reaction or adverse effects mainly depends on its routes of administration. Topical route may cause local skin irritation. If given through oral routes, it may cause symptoms such as headache, diarrhea, nausea, and vomiting. Meanwhile, IV route may cause transient renal dysfunction if given at high dosage or given to dehydrated patients. There are also some cases of aciclovir resistance, usually seen in immunocompromised patients, in which some of the resistant virus strains that have been isolated from this type of patient show alteration or deficient in thymidine kinase or DNA polymerase. Next is valaciclovir. Valaciclovir is an L-valine ester prodrug of aciclovir that is used for the treatment of herpes, varicella zoster, and cytomegaloviruses. Valaciclovir was developed to increase the oral absorption and plasma levels of aciclovir. Even though in general it is well tolerated, some patients may develop nausea, vomiting, or rash. Famciclovir is a guanosine analog antiviral drug used for treatment of various herpes virus infection, most commonly for herpes zoster. It is a prodrug from penciclovir with improved oral bioavailability. Penciclovir is a guanosine analog antiviral drug used for the treatment of various herpes virus infection. It is a nucleoside analog which exhibit low toxicity and good selectivity. Because penciclovir is absorbed poorly when given orally, it is more often used as a topical treatment. Trifluridine is an anti-herpes drug used primarily on the eye. Trifluridine does not require activation by viral thymidine kinase. It is phosphorylated to its active form by host cell enzymes and then competes with host thymidine triphosphate. then result in defective viral DNA. Trifluridine is effective in treating keratoconjunctivitis and recurrent epithelial keratitis due to herpes simplex virus 1 and herpes simplex virus 2. Topical application of trifluridine solution alone or in combination with interferon alpha has been used successfully in the treatment of acyclovir-resistant herpes simplex virus infection. Ganciclovir is an acyclovir gonorrhea analog. It has 20 times greater activity against cytomegaloviruses. Ganciclovir need activation by both viral and host cellular enzyme. Ganciclovir is administered intravenously and distributed throughout the body and excreted via urine. Its adverse effect includes severe dose-dependent neutropenia. Apart from that, valganciclovir is a prodrug of ganciclovir. After oral administration, it will be hydrolyzed to ganciclovir by intestine and hepatic esterases. Its clinical usage is the same as ganciclovir. Next is cidofovir. Cidofovir is a nucleotide analog of cytosine. Its activation does not require phosphorylation by viral enzymes. Cidofovir is available in intravenous, intravitreal, and topical administration. So its side effects include neutropenia, metabolic acidosis, and ocular hypotony. Foscarnet is not a purine or pyrimidine analog and does not require activation by viral or human kinases. It directly inhibits viral DNA polymerase, and RNA polymerase does interfere with viral DNA or RNA synthesis. Foscarnet is poorly absorbed orally and must be injected intravenously. It is used in cytomegalovirus retinitis and immunocompromised patients and acyclovir-resistant herpes simplex virus and herpes zoster infection. Adverse effects include nephrotoxicity, anemia, nausea, and fever. Hypokalemia, seizures, and arrhythmia also have been reported with this drug. And the last drug is fomepizole. Fomepizole is an antisense oligonucleotide directly against cytomegalovirus mRNA. It is used is limited to those who cannot tolerate or have failed other therapies for cytomegalovirus retinitis. The drug is administered intravitreally. The common adverse effect includes iritis, vitritis, and changes in vision. This diagram is just to summarize the mechanism of action of selected anti-herpes agents. Drugs such as acyclovir, penciclovir, and ganciclovir needs activation by viral specific thymidine kinase enzyme. On the other hand, drugs such as trifluridine, cidofovir, and foscarnet do not require activation by viral thymidine kinase, thus they are less risk of resistance. Okay, that's all for now. Hope you can refer to my notes for further details of the topic. See you in the next video. Assalamualaikum. Bye-bye.